Good nutrition is critical for child development, growth and survival as the country struggles to cut back the effect of climate change on food security. Children from the north are still paying the ultimate price of poor nutrition due to these disruptions. My name is Husna Mohammed, and on this episode of Health Digest, we look at how lack of access to nutritious diets is impacting on child health in North Horr sub-county. Not a drop of rain for 3 years in North Horr, Marsabit County. And when the rain did finally come, it poured to the joy of the local population. The Dasanach community that lives here at Ileret was not left out. But contrary to what many expected, malnutrition that has been plaguing them did not drastically reduce.
Maji imekuja kuchimba, sasa tunapata maji chafu sana. Ndio kwa maana watoto wanahara, wanatabika. Sasa kwenda hospitali hapa hakuna madawa. Sasa tuko na hiyo shida sana. Dawa tunapata ile inaitwa ORS ya kuweka maji na kupatia watoto hiyo tu. Hakuna dawa mzuri ambayo iko hapa.
The wet season is yet to positively impact production systems. The National Drought Management Authority NDMA April 2023 report on malnutrition is grim. Acute malnutrition cases across arid and semi-arid land counties are over 970,000 children aged between 6 and 59 months. Above 142,000 expectant and lactating mothers are also affected. This is attributed to the continued reduced milk consumption at household level. Marsabit and Turkana counties still remain in the emergency drought phase. Nyawei Nyakaru, aged 36 years, is a mother of 8. She is part of the many Dasanach families. Her 3 children have battled kwashiorkor and marasmus, which are as a result of malnutrition. Pneumonia has also been stalking them. Her 5-year-old twin boy is improved, but the 3-year-old daughter is yet to fully recover.
I never thought that my daughter would be alive today. She was so weak. She has been a sick child since she was born, and I am taking her to the hospital, but she doesn't get necessary treatment. It's MSF that really helped her. She looked alive again.
Na kuna watoto wenye tumewapeleka na wajai recover. Still huyo mtoto since last year alikuwa na shida ya diarrhea, vomiting, severe pneumonia, na akatibiwa. Baadaye akaanza kuwa na kwashiorkor na marasmus, akaweza kupata matibabu, lakini hali yake mpaka saizi bado hajapata matibabu vizuri. Mtoto bado ako malnourished.
In March 2022, Doctors Without Borders, or MSF, responded to the crisis by training healthcare workers at Ileret Ward. This helped in the managing of the acute malnutrition situation. During this period, a third of the town's children under 5 years were under the malnutrition response program. It is in December 2022 that the MSF team left and the Ileret people were again left to battle it alone. Malnutrition is a deficiency or excess of nutrition consumption. It is divided into undernutrition and overnutrition. Undernutrition is specifically caused by shortage of energy, vitamins, and minerals. On its part, overnutrition is caused by overconsumption of energy and micronutrients. Malnutrition contributes to more than a third of child deaths worldwide. Lack of clean water for consumption remains the local community's biggest obstacle. Most search for the precious commodity for almost 13 hours, only to come back home with a few liters of unfiltered water.
Before I boil and treat the water, the kids drink the water in a rush. Since they have been thirsty the whole day, they then become sick.
Kuna wale wako na manyumba mabati wanapata maji ya mvua, lakini wale hawana hiyo manyumba, wako na ya hii manyumba ya kienyeji. Sasa hakuna maji vile wanapata, lazima waende huko Laga. Wale wamesoma labda ndio kana hiyo ile manyumba ya mabati, lakini watu wa Dasa na yote nyumba ni hii tu.
Na maji tukiwa tunapata maji shida sana, venye laga inakuja na sana sana tunachota maji kutoka laga. Na hiyo laga kwa saizi hatupati maji nzuri, maji ni chafu kabisa na tunachimba karibu na mto na hatupati maji safi.
Nyawei had to walk for more than 6 kilometers to find a bottle of clean water for her youngest daughter.
I was advised by the doctors to feed her clean water, though I couldn't walk every day just for a bottle. I had to feed her our normal water, and she started vomiting, diarrheaing. She became weak again.
She has been forced to accept her 3-year-old daughter's condition.
I tried to feed her better than her other siblings, though she doesn't gain weight. I think maybe this is just her normal body.
Before the drought, goat milk came to the rescue. The kids drank it as a substitute for water. Right now, it's a rare commodity that is only within the reach of the local rich people.
It has been 3 weeks without supplements. She was to be admitted, but I cannot leave the other kids alone and take my daughter to the hospital. I was then forced to stay at home without medication.
Luck was not on her side. Galui Rabate, she lost her granddaughter who had been left under her care after the death of her daughter. Galui, who is visually impaired, could not take her 10-month-old granddaughter to the local hospital. After 3 days of constant diarrhea and vomiting, the little girl lost the battle.
Hakuna mtu anasaidia mimi, alafu mtoto fariki kwa nyumba yangu. Ilikuwa bado nyonya hata matiti ya mama yake, na mimi haina matiti. Matiti yangu ndio haina maziwa na homa na kitabaka yote na hara. Na haba hakuna kwa daktari. Alafu kukuja naye huko mimi haina macho, mtu ausilete mimi, hakuna mtu anasaidia mimi. Kwanza si hawezi saidia watu, unasikia? Mimi haina macho. Kama yuko na macho mimi mwenyewe tapeleka naye kwa ile simu yangu. Si mimi najua naye. Na hakuna mtu anasaidia mimi. Na watu wapande hapa watu hana macho usisaidianga. Ama kwangu bwana ni shauri yako. Kwenda nani shauri yako.
Local hospitals are not easily accessible. Children and adults seeking healthcare services die along the way. This is so normalized that it no longer comes as a shocking news to this community.
Hospitali ni mbali sana. Unachukua muda kitambo utembee katikati kwa sababu hatuna means ya kutembea nayo kama boda, magari, ambulance hatuna. Tunatembea nao watoto, tunafika hapo katikati mtoto anaanza kuhaga. Sometimes watoto wanarifariwa pande ya Ethiopia na huku kunatumiwa na kuna kadi yenye Ethiopia wanawachukulia, na kama hawana kadi juu wao ni watu wa Kenya hawapati matibabu. Pesa kupata ya kupeleka mtoto kurifaa kutoka hapa hadi Ethiopia kwa sababu huko ndio kwenye iko karibu na sisi, hospitali yenye karibu na sisi ni Ethiopia. Kitambo upeleke huko pia ni shida.
Yeah, we have already made a proposal to the county government to upgrade our dispensary here to either level 3, level 4, and to put more staff, medical staff, so that one is going to raise the level, to raise the standards of health standards, so that at least tuache kuvuka border kwenda kutafuta matibabu huko, because now at the border that is where most patients are referred.
According to Ileret Health Center in March 2023, severe acute malnutrition caseload was 166, while moderate acute malnutrition caseload was 545 children. While in April, the number of severe acute malnutrition spiked by 7 cases to 174 children, moderate acute malnutrition figures stood at 543. Severe acute malnutrition consists of kwashiorkor marasmus and marasmic kwashiorkor. This commonly happens when a person has not had food of adequate quality and quantity, coupled by frequent of prolonged illnesses. Malnutrition results to inadequate vitamins and minerals that are essentials for body functions, such as producing enzymes, hormones, and other nutrients needed for growth and development. Although malnutrition has been a sticking issue in Ileret ward since 2010, things got worse in 2022 After years of drought and dwindling food supplies, the situation became grave. So now that the much anticipated rains have finally fallen, why does the situation still linger?
Chakula yenye mtoto angefaa kupata kama balanced diet hakuna. Mtoto anatumia tu ni wanakula mahindi bila maharagwe. Wanapatanga sometime unga kutoka Ethiopia wanainunua. Unga hiyo ni maji tu wanapika nayo na chumvi, haina mafuta. Sasa mtoto kulingana na hiyo hali hawezi akapata afya mzuri, afya bora.
You know, as we are very far from Marsabit. In fact, even here vegetables is a very big problem. So huwezi pata hata kuna watu hawajaiona ndizi hata machungwa.
Alcoholism in Ileret is a pandemic on its own. Not even mothers of affected children are spared. It has been noted with concern that a number of women sell supplements given to them in exchange of a local brew known as kada. The supplements are distributed for children by governmental and non-governmental agencies.
In our program, we have so many children that we give supplement in the facility. Because if we give the mothers, they go and sell. They exchange with alcohol. So we have decided that we have identified some families. Every morning, around 20 children, they collect supplement in our facility. We give them in the facility in the morning, and then in the evening. You see such families, those kids will not end up curing. They will stay in the program until there's time limited. Some of them even stay in the program for 5 years. Then after 5 years, those kids have to be discharged because the program only it only covers 6 to 59 months.
An average woman in Ileret has 8 kids, with 3 being under 5 years. Feeding them is a challenge.
I cannot give this kid this supplement, and the others are seeing, they are crying. As a mother, I have to share, to give all the kids because they don't have another food, so they have to share. So if they share, you know, the ones who are sick, they will not recover.
The lack of food in many households has increased the enrollment of children in schools. The school's feeding program is the hook.
They believe that at least in the school they can get lunch. Yeah, and also that it has improved a bit in our family planning measures, because they are now saying if we deliver so many kids, what will you give the kids? So some of them are now coming for family planning.
While clean water is a basic necessity for any community, this commodity remains a pipe dream for locals in Ileret.
We have to tell the mothers to give these kids all those 5 sachets, and they have to give a lot of water. Yeah, so because sometimes if you give without water, most of them get diarrhea. For example, if you take 2 sachets, that thing is very thick. It has a lot of nutrient. So I believe it will end up taking water from your body. Yeah, so that is why even the kid himself, you'll ask for water.
Malnourished kids are prone to waterborne diseases due to their weak immune system. It is on January this year that the Doctors Without Borders conducted a geophysical survey to establish a point where a supply of soft, clean water can be drilled and sustained for a longer period.
Tuna drill up to 40 meters because at least tunataka wapate soft water. Tukienda zaidi ya 40 meters, itakuwa na chumvi nyingi ambayo sasa itakuwa suitable kwa community.
And for each borehole, we put in place a committee. The committee is elected by the community and will train by MSF to manage the water point in the communities. The contractor will train inside the water point committee, and also MSF will give them a training to understand better how to resolve conflict, how to manage a water point together with the community.
In Kenya, more than 2 million children have stunted growth. This is the most frequent form of undernutrition. If not addressed, it has devastating long-term effects, including diminished mental and physical development. Although change wasn't expected overnight, families here are still struggling with malnutrition. The lack of clean water and proper balanced diets pose a health hazard for many families. Children under 5 years are the worst hit. Husna Mohammed, KTN News, Ileret, Marsabit County.